Assalamualaikum warahmatullahi ta'ala wabarakatuh, ma'am. I am Kakasi Alni Harbalo, and for this video return demonstration, I will be performing two procedures, namely assisting the mother to start breastfeeding as well as assisting the mother to different breastfeeding positions. So I'll first begin with their SOPs. The first procedure, this pertains to supervising and teaching the mother with confidence as well as encouraging them to start breastfeeding their infants. So the purpose of doing so is so that we can avoid any complications to the mother while breastfeeding, so that we can also promote uterine contractions, so that we can prevent hyperthermia and hypoglycemia, and of course to release oxytocin. Now for this procedure po, the first thing we're going to do is we're going to encourage the mother. So sasabihan po natin si mother na mag-perform ng hand washing. This is so that we can prevent infection transmission as well as the spread of microorganisms. Then we're going to explain po to the mother what we're going to do for this breastfeeding procedure and the correct things or correct positions we should or she should do. This is the correct mother position, the baby's position, the baby's attachment, the baby's suck, as well as the duration for the breastfeeding procedure. Then we're going to provide po the breast care sa kanyang breast. This is to ensure po na there's no infection transmission as well as hindi po contaminated yung milk na masasak ni baby. So, ang gagawin po natin sa breast care is kukuha po tayo ng fresh and clean towel or cloth. It should be moist as well. So, parang i-rub po natin yan and ensure po natin na wala pong soiled particles sa breast ni mother. And then, after that, we're going to hold the mother. So, if nakahiga po si mother, i-assist po natin siyang umupo into a more comfortable sitting position. So, this is to ensure na comfortable po yung mother while breastfeeding. And the next is we're going to give the baby to the mother for her to hold. So, kunwari po ako yung mother. And ito yung baby ko. So, ganyan. Tapos, after makuha na ni mother yung baby niya is, we can cover them both with a blanket. Para po, we can ensure na they're both warm and comfortable. So, now we're going to ensure that the mother, if ako yung mother, we're going to ensure that they are in a comfortable sitting straight position. So, ganyan. If hindi naman, we can provide a pillow for her to support her lower back. And we're going to see her lap if it's too elevated sa baba. Then we can provide for her a stool for her to step on para naka-elevate po pataas yung kanyang lap and ma-facilitate po na yung easier breastfeeding procedure. Then we're going to make sure that the baby's head and body is in a straight position. Ganyan. We're going to make sure na his or her nose is opposite to the nipple, and we're going to observe if masyadong nakababa yung body ni baby, and we're going to provide for the mother a folded towels or blankets or pillows para po masuportahan natin yung baby sa baba. So we're going to place that at the mother's lap and masuportahan po natin yung easier breastfeeding procedure kay mother. And after that is we're going to show the mother the proper technique to hold her breast during breastfeeding. This is the C technique, wherein yung thumb is nasa taas ng kanyang breast and yung other fingers is nasa baba. So, pag ganyan po. So, that's the C technique. This is to ensure easier milk flow during breastfeeding procedure. After that, we're going to instruct the mother to let her nipple touch the baby's mouth para po ma-open ni baby yung kanyang mouth, and so that we can start with the breastfeeding procedure. Now is we're going to teach the mother, sorry for the distraction, to break the suction of the baby. So, we're going to tell the mother na i-depress po niya yung kanyang areola. Depress po meaning is parang ibababa po niya, ganon. So, and allow for the baby to release the suction herself or himself. So, this is to ensure po na hindi tayo nasasaktan pag suddenly pong inaalis po natin pabigla si baby para po gentle lang yung pag-break natin sa suction. And then after that is we're going to observe and chart for the baby and the mother's reaction to the breastfeeding procedure. If nabusog po ba si baby, if kulang po ba ng gata si baby, ganyan, hindi pumaproduce si baby or any reaction at all. Now, we're going to proceed to provide health teaching kay mother about a few things, no? About breastfeeding, of course. This is that we're going to tell the mother that to give baby breast milk, purely breast milk during the first 6 months of life of the baby as much as possible. No formulas or no bought products, milk products for the baby na hindi naman prescribe ni OB healthcare provider natin or anything ganyan. Then we're going to tell the mother to feed the baby on demand whenever the baby's hungry or whenever the baby wants. Not it should not be neglected or scheduled. Ganyan. So we're going also to tell the mother to use both of her breasts during breastfeeding, to use different breastfeeding positions that she will feel more comfortable and relaxed in. Also, to keep the baby breastfeeding even if he or she is sick and even if the mother is sick as well. Kasi minsan may mga belief dyan na nakakapaghawa daw ng sakit if pinapa-breastfeed pa. So, no. And lastly is we're going to increase to feed the baby, or we're going to increase the milk supply of the baby, especially during growth spurt stages ni baby. Yung growth spurt stages ni baby is during 10 to 14 days, 5 to 6 weeks, and during the 6 months of age ni baby. Ayan. So now, lastly is we're going to assess for the perception and feeling of the mother of the breastfeeding procedure, so that we can ensure the effectiveness of the procedure, health teaching that we provided her, and yeah. Now for the next procedure, as its name implies, we are going to educate the mother to of different breastfeeding positions, as well as analyzing the misconceptions of the mother and the wrong breastfeeding techniques of the mother, and then correcting those. So the purpose of doing this procedure as well is to correct and so that we can ensure that the mother is breastfeeding her baby correctly, so that we can encourage the mother to start breastfeeding and not use formulas. And of course, lastly is so that we can prevent the milk ducts of the mother from closing. So the equipments we'll be needing for two of these procedures, both of these procedures, we need pillows and warm blankets. The considerations that we need to take account is that we need to maintain comfort as well as to maintain privacy at all times, because these procedures require the mother to expose their breast, which is a private part for woman's body. We need also to make sure that the mother is in a comfortable and correct position at all times while breastfeeding her baby. And of course, we need to make sure that the baby is comfortable as well and in a correct position while sucking at the mother's areola. So the things we need to document is we need to document if this is the first time of the mother to breastfeed, and if so, and even if not so, we're going to ask her how was the experience, how was the breastfeeding experience. We also need to document any unusual findings, any abnormal findings, as well as we need to document and take note of the different breastfeeding positions that we have just executed. Okay, so for this procedure, the first thing we're going to do is we're going to help the mother prepare for the breastfeeding session, just like yung ginawa po natin sa previous procedure. Now we're going to explain the benefit of proper breastfeeding positioning and show or assist how each position is being followed po. Now, first position, we have yung cradle position. Gagawin po natin sa cradle position, first thing is we're going to position the mother to sit in a upright position. And we're going to allow the mother to rest her feet on a stool or an elevated surface para po ma-elevate yan yung lap niya and we can facilitate easier breastfeeding procedure. Now po, we're going to instruct the mother to hold the baby on her lap so that the baby lies on her side with the baby's head or on her forearm closest to the breast for feeding. So, if dito po, dedede si baby, is ito pong right forearm din yung gagamitin pang support. Ayan, so ganyan. And we're going to have the mother support the lower of the baby with the other arm. So, ito po yung free arm natin, yung left arm. And we're going to use that as another additional support kay baby. So, pag ganyan po. And this is the side of the breast where the baby is breastfeeding. So, ganyan po yung cradle position. And then, we're going to lift the baby so that their nose is at the same level as the mother's nipple. And this ensures po na elevated po si baby and easier po yung milk flow kay baby. And then, we're going to use a pillow to be placed under the mother's arm for additional, this is for additional support. Ayan, to ensure na supported po talaga yung baby while breastfeeding. Another position po is we have the cross cradle position. So for the positional hold is we're going to first same position pa rin, still in a upright sitting position, and her foot is still elevated on an raised surface or stool. We're now going to instruct the mother to place the baby along the opposite forearm to the breast they will be feeding. So if sa right breast nagbe-breastfeed si baby, then left arm po yung gagamitin natin. So we're going to do that, and we're going to place the hand of the same arm wherein nagbe-breastfeed si baby, right arm na, behind the baby's ears and neck with the thumb and index finger behind each ear. So ganyan po yung mangyayari. Ganyan. So, the baby's neck must rest between the palm and the fingers for extra support. So, we're also going to instruct the mother to hold the baby along the opposite arm from the breast you are using and support baby's head with the palm of her hand at the base of the baby's neck. So, ganyan. Ito yung supporting. Ito yung gagamitin from ears to eyes, and then yung sa left forearm is yung hand po natin is nakasupport sa base sa neck ni baby. Ganyan. So, this ensures po that correct po yung positioning and comfortable si mother as well as supported po talaga si baby during breastfeeding procedure. After that, bring the free arm across to give extra support or use to position your breast for a good latch. Ayan. So, another additional support. Now, another position po is we have the clutch or the football, the rugby, or the koala hold. So, for this procedure po, still the mother is in a sitting position. So, next, we're going to assist the mother in tucking her baby to one side. So, left side yung gagamitin natin. Kunwari, I'm the mother, resting the baby's body and bottom along the arm closest to the breast they will be feeding on. So, the baby's legs are positioned behind the mother and the head is at the breast. So, mangyari niyan is pag ganito po. Ganyan. So, ask the mother to support the back of the baby's neck with the hand of the same arm. Ganyan. So, place a cushion. We can place a cushion or a pillow or any support under the mother arm wherein she carries the baby's body. So, pag ganyan po. Ayan. So, nasa likod. Ganyan. Next is we have the side lying position. So, for the side lying position po, the position that the mother will be feeding on is naka-side lying po siya. And then we're going to place pillows or cushions behind the mother's back, under head, and or between the knees. This is so we can facilitate support kay mother. And mas ensure po natin na komportable si mother. Next is we're going to place the baby in front of the mother. So, kunwari, nakahiga po si mother, ganyan, ipo-place po natin ng paganon sa in front of the mother and with her body parallel to yours and their abdomens are facing each other. So, ganyan po. So, parallel lang po yung si mother and si baby. This, next is we're going to ask the mother to use her free hand to guide her baby towards the breast. So, parang ipupull over niya po si baby niya para mas malapit po yung attachment ng baby sa breast. And then, this arm can be kept behind the baby's back to keep them, this is to keep the baby stable as well and closer to the mother. So, yun po yung side lying position. So, nakahiga lang po sila. And, next position po is we have the last procedure, which is the reclining position. So, yung reclining position po is also called as the biological nurturing. So, we're going to plop pillows or cushion on a bed or sofa para po comfortable yung katawan ni mother, and then we're going to instruct the mother to lie on her back on a prop pillows to assuming a semi-reclining position. So we're going to rest the baby prone on the mother's chest or abdomen, ganyan, and we're going to allow the baby to find the mother's nipple and self-attach to the mother. So nakahiga po si mother, ganyan, naka-recline po siya, and dumedede na dyan si baby. Okay, so this is for mothers po that have struggle with breastfeeding while sitting in a sitting position, kasi possibly nagka-CS operation sila or ganyan. And as well as po yung sa koala hold, yung paganyan, yung football hold, this is designed for those mothers who have twins as well, na pwedeng mag-breastfeed on both breasts. Ayan, so I can also instruct my mother to use pillows on different parts of her bodies, pwedeng under her elbows, her arms, her knees, her neck or back, para po ma-elevate natin yung level of comfort, ma-promote po natin yung comfort kay mother, because there are different positions that work with different mothers, and what might work for this mother might not work for her. So we have to keep that in mind. We have to be open to that idea. So that's why we're going to have to instruct the mother to keep trying different positions until mahanap niya po yung the best sa kanya, most suitable po sa kanya. And so we're next going to assess the mother and the baby and look for any difficulties and ask what position the mother feels more comfortable the most. And so that we can ensure na suitable and comfortable talaga si mother sa position na she feels most confident to breastfeed on. So next, I'm going to chart my observations of the condition of the mother as well as yung sa condition ni baby. Ayan. So this is to ensure continuity of care. We can suggest any follow-ups or referrals, and any health teachings that we can provide, may provide po natin. So that's all for these two procedures po. Thank you for watching, and wassalam.